board is sincere
wellness. Ladies and gentlemen, members of the media, Jamaicans who are listening on, and of course to my colleagues here at the ministry. First, let me apologize for the 20 minutes or so late start. We will try to make it better next time. In our usual COVID conversations, we will provide the information, an update. In addition to that, though, a special feature will be to have a conversation around the numbers and what they mean, and our epidemiologist, Dr. Webster Carr, will spend a few minutes just to highlight what the current numbers mean. And then from there, we will speak to a patient that is fully recovered, just to get her experience in the state care, but also since she has been released. She has done her 2 negative tests and is now at home. So a lot to look forward to, but we'll try to keep it within an hour and a half maximum. So thank you very much, and I'll go straight into the briefing. So firstly, I want to begin by saying that we continue to see patients with COVID recovering at an increasing rate, and that's a very positive development that I think Jamaicans would want to understand and continue to be updated on. So we have in the last 48 hours had 8 more persons recovered from COVID-19, the procedure being 2 negative tests within a 48-hour period, having had an initial positive test. The total number of recoveries are 57, and we continue to monitor the others. For the most part, these individuals are showing very good signs of recovery. In fact, I don't think we have anyone now in a ICU setting, but the CMO can correct me. I'm told no, which is important, and that's why the discussion around the numbers is so important, because for the most part, persons who have COVID are in fact recovering. Unfortunately, however, the last 24 hours, we have seen 5 additional persons testing positive for COVID-19, which brings our numbers now to 478 confirmed cases on the island. One of the new cases is an 18-year-old male from St. Mary, and he is a contact of a previously confirmed case. The others are 3 men who range in ages from 18 to 69 years, and 1 woman who is a 17-year-old. Additional cases we are pending as the test results continue to come in. It's a very fluid situation. Of course, we will keep you updated as we get that information. In terms of classification, 35 imported cases, 171 cases are contacts of a confirmed case, 11 are local transmission cases not epidemiologically linked, and 257 are under investigation. 221 of those, of course, linked to the workplace cluster, and an additional 36 others. 4 are to be classified. The age ranges for the confirmed cases continues to be 2 months to 87 years. There remains 221 confirmed cases related to the workplace cluster, and they are primarily from St. Catherine and Kingston and St. Andrew. Their ages range from 18 to 53 years, and they include 166 females and 55 males. The workplace cluster, of course, I refer to is a BPO operation in St. Catherine, and we have since, the government that is, announced a series of measures to to mitigate against the possibility of this kind of outbreak within that workspace. We have done a number of inspections. Currently, as you know, 62% or 62.5% of the 32 BPOs now in operation have passed the inspections. That's 20 of 32. The remaining institutions have been provided with work plans to improve their infection prevention and control measures. So 20 are considered satisfactory. 12 needs more work, and closure instituted by the Ministry of Health 4 fall in this category, and with some reopening dates set based on the actions that are to be taken. We have seen also in recent times improved compliance and reopening permission given to 2 additional others. In terms of testing, so far we have seen some 6,095 samples tested. 5 new positives for the day, as said earlier. Of the 6,095, in addition to the 478 that have returned positive results, 5,576 are negative, and as said earlier, 41 are pending. In the last 24 hours, 102 new samples were tested. We will comment more on the testing, the issue of testing. There's a lot to be said. I know there's a lot to be said. I know there have been some questions asked around testing, and we have taken some decisions to expand testing even further. But I'd like to make it very clear that when compared with other jurisdictions, certainly in the region, on a per capita basis or per million of population, themselves, and we are going to be managing that process through the jamcovid19.com website, which we hope to be available for applying or expressing your interest over the next week or so. Again, we can elaborate on that. Another item worth noting is on the expenditure of the COVID-19 activities. As you know, a few days ago, I think last week it was, the ministry published the numbers as it relates to how resources have been allocated and spent on the COVID-19 response. And I'd like to announce that the Auditor General has expressed an interest in auditing those numbers, or the ministry, as it relates to COVID-19 expenditure. Of course, we have no issues with that. I think that's important for transparency and accountability. And that audit will commence, I am told, sometime next week. The executive management of the ministry welcomes the audit as a tool for effective and efficient implementation of activities and for transparency and accountability. And the public will, of course, be provided with any detailed outcome. Of course, the Auditor General has a process that leads to that kind of expose. So just to note that for the public's understanding as to where we are. In conclusion, I want to just say in this segment that it is now more important than ever that Jamaicans continue to remain vigilant in their infection prevention and control measures. Repeating again what the government has been saying, staying at home if you don't have to go out, maintaining physical distance of 6 feet from each other, avoiding crowds, wearing the masks when out in public or when in crowded situations, frequently washing and sanitizing hands. And of course, as Jamaicans, all of us are encouraged to cover our mouths and noses if sick or when out in public. We believe here at the Ministry of Health and Wellness that there is general appreciation for these measures. We think for the most part persons are engaging and abiding by what is being proposed, not in all cases, in some cases. And so it's important for us to continue the messaging. We do believe that we're moving into another phase of COVID-19, and as a consequence, there are other measures that are going to be necessary even while we begin a process of normalization of our society and economy. But nevertheless, we can't let down our guard. We have to stay focused because this is a virus that can significantly impact our lives, the lives of our family members, community, and by extension, country. But I do believe that we're making the right decisions and that we are, in fact, making progress. So that's my brief overview of the numbers for today. And I believe we should go into questions now, and then we move into the next segment.
Thank you very much, Minister. So we invite members of the media who are on the Zoom to use the raise hand feature and to acknowledge or to let us know what entity you are from, your name and the entity you represent, and with your brief question. I'm going to go to Kate Chappell.
Yes, good evening. Thank you for the question. I was wondering,
Kate, could you introduce what entity you're from?
Yes, from 18 Degrees North. Yes, since it's Child Month, can you say how many children have now tested positive for the virus? What are the age ranges? What parishes they're in? And are there any in critical condition? And if any, how many are in hospital? Thank you.
I'm going to ask the CMO if she has that kind of detail. I certainly don't. Any information on children who have tested positive? What are their ages? What institution they're in? What's their state now?
Right. So we've had 473 persons that have been confirmed positive for COVID-19. And if we look at the age distribution for that, we have in the 0 to 9 age group, we've had 35 persons. In the 10 to 19 age group, we've had 54 persons. So that's 35 persons in the 0 to 9 age group and 54 persons in the 10 to 19 age group. In terms of hospitalizations, we've actually had very few children that have been hospitalized. I don't have the number, but I believe we've had about 4 children that have been hospitalized, and as you know, we've had one death, unfortunately.
Thank you very much, CMO. I'm going to go to Dion Jackson-Miller.
Good afternoon, Dion Jackson-Miller, RGR TBJ. Mr. Minister, how could your team have concluded that Victoria Jubilee and the University Hospital of the West Indies followed protocol retransferring the Jody and Ferron case, given that the Ministry of Health's Manual for Transfer of Patients 2016 on page 19 says where bed space is a challenge at a higher level receiving institution, all efforts must be made by the institution to identify bed space. Where highly specialized beds are not available, the institution should accept critically ill patients for intermediate care. That's one question, because this seems to go against what we saw happen. And the second question, both Dr. Elon Thompson and Dr. Alfred Dawes say that the ministry's protocols are essentially unworkable because we don't have the staff in the institutions, especially the smaller hospitals, to follow the protocols. Is the ministry finally going to address the problem of an inadequate cadre of staff at our institutions?
All right, I'm going to ask the Chief Medical Officer to address the protocol, the specifics, the technicalities of the protocol. Just to add, though, that the report that I have received based on the investigation, the internal investigation, and the reports that were sent from the respective hospitals is what I articulated when that question was asked of me. So I did not deviate in any way, shape, or form, and clearly would have to depend on that technical assessment. But the Chief Medical Officer can elaborate as it relates to how transfers take place and the manual. Beyond that, though, your last question around when the government is going to address the issue of capacity. You know, Dion, it's an open secret that the public health system is limited in its capacity. It's an open secret that we lose 400 or 500 specialist nurses each year to mass recruitment, even though we continue to train and even expand training. And I could go on in terms of the underinvestment in public health. It is also, should be known by now anyway, that in May of last year, in my sectoral presentation, I announced what should be considered the most comprehensive 10-year development plan for public health, with a budget to expand and upgrade a number of hospitals, including Spanish Town, the University Hospital of the West Indies, KPH, of course, restoration of Cornwall Regional Hospital, a new adolescent pediatric hospital in the Chinese partnership, and I could go on, including health centers, health information systems, as well as a renewal of primary health care, which will see additional capacity being added. So I will accept fully that the system has been neglected over an advanced period of time, and perhaps some may argue for good reason because of the indebtedness of our country and so on. But what I will also say, and I say with confidence, is that we have a roadmap for correcting this, and we have started that process based on the 10-year plan that was advanced, the IDB funding, the EU funding, and GOJ funding that was announced in the last budget. So I think we will be in a better place with time to correct some of those very ills that you have recognized. On the protocol issue, I'm going to ask the CMO to speak to how transfers occur and whether or not in this case that did happen.
Right. Thank you for your question. I just want to say that myself, having worked in the hospital system for many years, I can't help but recognize the challenges that we do face in terms of transferring patients. And each facility will have a limit in what it can accept. And it is always challenging as to how it is that we move patients to places where they can be appropriately cared for. With regards to the movement of this particular patient, I must point out that while it was that the Victoria Jubilee did have all its isolation spaces occupied, that we did make arrangements for the transfer to be accepted at the Spanish Town Hospital, where we did identify that there was space available. So with regards to having space elsewhere in the system, yes, we do make the efforts to find that space. Sometimes it is not acceptable, but we do try to get persons to the level of care. And we had identified at that time that Spanish Town did have the level of care that was suitable and appropriate for the management of the patient. And if the transfer was in fact pushed at the other end for it to be done, then the person would have gone straight to Spanish Town Hospital.
Wasn't that negated, though, by the fact that she then had to be transferred from Spanish Town to the University Hospital? And just as in terms of a reminder of my initial question, which is that the minister said in Parliament that the institutions had followed protocol. And what I read from the manual seems to be a direct contradiction of that.
Well, what the protocol says and what the protocol alludes to is the fact that if it is that space cannot be found in one hospital, then we would try to accommodate in another hospital. So with regards to that protocol, that was in fact done. The fact that she did have to be transferred to a higher level of care did happen, and the fact is that we have to manage based on the resources that we have available within the public health system. We did do what was possible for us to do at Spanish Town Hospital, and our protocols dictate at that point that if we are unable to provide the level of care, then we move to the next higher level of care. So we have to respond. This is an unfortunate incident that happened. If we could have planned how it should have happened, then certainly it would have happened otherwise. But I think in terms of our response at the Spanish Town Hospital and the movement of the patient to the university at that point, that, I mean, we did the best that we could do for the patient at that time.
Thank you very much, CMO. I'm going to go to Jamaica Social.
Good evening, folks. Two questions, possibly for the minister or the CMO. I'm Cassius Watson for Jamaica Social. Have you ironed out your protocols for antibody testing as yet? And when do you see that kicking off? That's one. The second question, how will tourists and visitors be accepted into the country? Will there be, what kind of protocols are you looking at? Have you started thinking about that, seeing that we want to open up and tourism is our largest foreign exchange earner? Have you started thinking about that? Will visitors have to come in with a special certificate of fitness? What will it look like? Just to give us an overview of what that looks like. Thanks.
With regards to the antibody testing, just to explain a little bit where that is concerned, I think that every Jamaican has to understand that there are different types of testing that are done at different times during an epidemic. And the different types of testing that we have are to answer different questions. So at the start of an epidemic, what we want to do is we want to quickly detect and to contain. So therefore, we're going to be using a test that has that capacity to tell us that the person has a disease so that we can treat, and we can treat now. We would not rely on a test that would take some time for it to become positive because it delays your diagnosis. However, the value of the antibody test in terms of categorizing what is happening in an epidemic is also important information that we can utilize in moving forward. because at this point in time, after we've had several areas where we have had cases, we would have not been able to detect all the cases that would have been possible, that would have all the possible infections that would have risen out of those cases. And there are many persons who would not have shown symptoms or would have been so mildly symptomatic that they would not have considered themselves to have symptoms. But in terms of wanting to determine the level of exposure of the population, that is when we would now look at the antibody test. That would give us an idea as to whether or not the persons within those communities had an exposure to the virus. So that helps us now to plan forward, because when we are containing, we are protecting the population from an exposure. What is the sense of protecting if they're already exposed? So that is what we want to know. But we have to be very, very careful in answering that question, because we don't know, as the rest of the world doesn't know, what is the level of immunity that persons have. If it was that we knew for sure that after being exposed to COVID, immunity, then we would know that if we could determine if, for example, the entire Bull Bay and the entire section, eastern side of that island, were exposed, then we'd be in a good position, because we would know that we don't have to protect those persons anymore. They have already been exposed, and therefore they would not need the protection. But the problem is that we don't know how long the immunity lasts for. So even in using antibody testing in countries, and many countries are looking at that, even in using that to determine, is it that the population is at a safe level for us to now open up, you have to be cautious, because you don't know the level of the immunity that persons will have. So the value of antibody testing is really to determine at this stage what was the prevalence of the infection within the country. And that gives us an idea of the level of immunity. And if that level of immunity is going to take us into years, then that would be great.
And the short answer to the question is that we have ordered the antibody tests, right, CMO, and that we intend to administer that test along the appropriate levels of protocol, as explained by the Chief Medical Officer, in short order, for the particular purpose for which antibody testing is intended, which is not the same as the PCR test, which deals with identifying the virus. I think that's an important point to make.
Just to add that in taking on the antibody testing, we are doing this from a very, we are trying to be as right in what we do in terms of the interpretation of these tests, because we really do not know the level of other coronaviruses that we have in the country, and therefore the level of antibodies that our population have to those other coronaviruses that can cause, for example, the common cold. And so when we get a level of prevalence of coronavirus, we don't want it to be interpreted wrongly if it was that we had that level from before. And we also have to also make sure that we look at the cross-reactivity between the antibodies that come from the coronavirus and other viruses that we have in our population. So with the cooperation of our National Public Health Lab, we are going to be looking at samples that have been taken of the population over years. And we're going to be looking at this antibody testing and the results in those cohorts of persons to be able to compare any results that we have now coming out of this antibody testing that we're going to be doing on these persons who we think have been exposed to COVID-19, so that we can get an accurate picture of what it is that is happening in the country.
Well, I just want to say that there's an update on the BPOs. Number of BPOs, 96. numbers exempt 59, numbers inspected 95, and satisfactory inspection 28. I think these are more updated numbers than what I announced earlier. Go ahead.
Second part of my question, please, regarding tourism and our visitors.
Let me just say that you would have heard the government announce an economic recovery plan or roadmap, which would include, of course, opening up different areas of the economy, including the tourism industry. A number of subcommittees were appointed. The Ministry of Health and Wellness is an important part of that initiative. In fact, I chair the Resilient Subcommittee, which includes not just the health personnel, but other private sector leaders and others. That initiative will, in a combined and holistic way, assess a number of issues, which includes the public health concerns, to take decisions as it relates to the tourism industry and other industries. In other words, I can't give you, or we can't give you a specific time and date now, but there is a pathway that will lead to that. So I would just say stay tuned, and you will get more details over time. Thank you. Next question.
Thank you very much, Minister. I'm going to go to Brittany Clark.
All right, good evening, everyone. So I have 3 questions. I'm asking if I could ask 2 and then ask the other after the 2 are responded to. So the first question, how many more Alorica BPO workers are outstanding to contact the Ministry of Health? Have any more conduit BPO workers been tested, and have any of those additional tests returned positive? And the next question, we currently aren't testing at full capacity, which has its attendant dangers. Did this inform part of the ministry's committee decision to make that improvement to the testing capacity, which is to now make it available to everyone? And what are the plans going further to additionally fix the testing or under-testing issue that has lingered for weeks?
All right. With regards to the testing protocol, what we have found is overall our test. Well, let me just say first of all that our testing protocol is really designed to pick up the most cases from where we're likely to get the cases, and so that is from persons who are contacts, persons who have respiratory illnesses, and then through our surveillance program right across the island. Now, because of the stay-at-home policy, what we have been finding is that there have been decreased visits to our health centers and, as a matter of fact, to our hospitals. As a matter of fact, I think that we are seeing probably maybe about 50% in some instances fall in the number of visits to health centers and to hospitals. As a consequence of this, we are getting less cases of respiratory illnesses that are presenting to hospital, especially the mild cases who may be staying at home. So we are making a concerted effort to try to get these persons tested by asking them to make an appointment on the website to come in for testing. Now, it is not open up to the general public per se as to if you want to get tested, you get tested, because you're going to be screened through this site as well. And we're going to see if you are the person that needs to have a test done. Because essentially we want all the people who need to be tested to be tested. So this is one opportunity for the persons who are at home, who are not coming out to their health centers, to be tested. And then we are also reaching out to our general practitioners, because we do recognize that persons are still visiting their general practitioners, but the general practitioners would not be in a position to do the testing. So we have collaborated with several of our general practitioners, and our health centers, through our health departments or medical officers of health, are open to this for the general practitioners to make contact to say that we have patients that we can arrange to come in at a certain time, or if it is that we can just direct the patient straight to the health center to have the testing done. And that has been taken up by our general practitioners right across the island. We have seen an improvement in that. But we continue to expect that the numbers will increase from that as well. Now, what we don't want at the end of the road, right now our case fatality rate is pretty good. I mean, we've had 9 deaths, and we regret to say that we've had 9 deaths. However, in the overall scheme of things, our case fatality rate is less than 2%. What we don't want to see at the end of the road is for persons to ask, have any of the other persons who have died in hospital, could they have been COVID positive? So that is why we are moving to test all our admissions to hospital. So that will help us to understand, because there is a relationship between the case fatality rate and the number of overall cases in your country. There is a relationship based on what we've seen across the world. And so therefore, if you know that you're seeing a case fatality rate that is in keeping with what your expectation, you know that your testing is adequate. And that is something that we have looked at to say that based on the number of deaths, because you really can't hide deaths. They happen. Most of them will present to hospital, or they will present to other areas where we will pick them up. So we know the numbers of persons that are dying. And we are now testing everybody that will come into hospital. That is our next move, to ensure that we don't have anybody who looks like something else that could possibly be COVID. So in that way, we're trying to keep our testing numbers credible in relation to what is the bigger picture. So in addition to that, we are going to be looking now that we have gotten rid of this huge backlog that we've had, and we've seen that, we have the decrease in the numbers of ILIs and SARIs. So I've outlined the measures that we're doing to increase those, but now we're also going to be looking at targeted groups that we have been seeing cases in, and groups that we think are at risk. For example, our transportation persons or security persons. We're going to be looking at some of those groups. We're going to be guided by what is happening in our parishes, and we're going to be taking on some of those groups to do routine testing to see what is the level of the disease in these cohorts.
Thank you. Just an update on Alarica workers. How many are outstanding to contact the ministry? And is there any other updates on the conduit BPO workers who have been tested? Have any more tested positive?
For the conduit, we have not had any additional positive workers so far, but we continue to test, okay? We've had another batch of tests that have come in that we have to go through in order to make sure that we don't miss anyone. But so far, that situation is looking good. In terms of Alarica, we right now, based on the number of cases, the number of tests that have been done, it appears based on our numbers that we have tested between 80 to 90% of the persons that have been sampled, okay? Now, I believe that some of those 10% may be repeats. We have to be looking through the system to try to identify some of these to see if results had gone out, if there were repeats done or what, to try to match the databases to make sure that there was nobody that was duplicated. But essentially, our real aim at this point, based on having tested the workers and then testing their contacts, our appeal at this point would be to the Alarica workers who have elderly persons in their homes, or who have anybody who have persons who may be at risk for more severe disease, to say that these are the persons that we would want to monitor very carefully. We have gone now about 3 incubation periods since the start of Alarica. And so therefore, we'd be expecting that the contacts of the first set of contacts would be the persons, and that is getting into the homes. That is getting into the homes, and this is where the vulnerable persons may be. And this is where we would want these persons to reach out to us to call our hotlines so that we can follow up on these persons closely to be able to pick up any illness early so we can manage it appropriately.
All right, thank you very much, CMO. I'm going to go to Emma Lewis.
With Pacheri and Global Voices. Sorry.
Emma? Go ahead.
Can you hear me?
Yes, go ahead, please.
Okay. Yes. I have a question about the mobile testing units. How are they doing? Where are they going? Who are they testing? How many tests have they done? And I also had another question which I've forgotten, so I'll just ask you about that one. About the mobile units.
Okay, so I can't tell you exactly how many tests have been done through the mobile unit. However, I can tell you that it has been a very, very useful tool in our set of items that we have to use, because we have been able to get into communities, and in particular where we have large clusters, to be able to get testing done quickly. We have been able to utilize this. So it has been a very useful tool in enabling us to get through large amounts of sampling easily and without too much stress on the health departments that are very, very busy with contact tracing.
Thank you very much, CMO. We're going to go to...
Could I have, sorry, one more question. I'm sorry. I've been reading some things about mutating viruses, that the virus that affected New York, for example, was rapidly changing and mutating. Is this a concern for you? Maybe it's rather a technical question. I thought I'd just ask about that. I'm curious.
Well, I would say that, like you, I'm reading about it too, and we always are concerned about the possibility of mutations of these viruses. However, we have not seen anything that is significant that has been reported that would affect our management and the protocols and procedures that we have in place to deal with the coronavirus, SARS coronavirus 2, as it is that we know it now.
Thank you very much, CMO. We're going to go to Owen Brown.
Good evening. Yes, this question is basically regarding St. Mary. For St. Mary, we've seen 15, an increase in cases in St. Mary. What's the level of contact? Where is basically contact tracing in that parish? And for the use of COVID-19 treatments, I know that there has been a decision regarding interferon and hydroxychloroquine. Is there any consideration for any other treatment of COVID-19 in Jamaica? Any other treatment? Those are the two questions. Thanks.
So for the contact tracing in St. Mary, we continue to do that. And as the cases are discovered, then the new measures are put in place that are determined by what is happening on the ground. So that is still an active site for us that we're doing a lot of work in. Right. In terms of the other treatments, I just want to take the opportunity to remind Jamaicans that we have in fact put together a very good team of clinicians, expert persons from right across the island in all different fields who are constantly reviewing the material that is put out internationally, regionally, and based on their determinations, then we make decisions whether or not what it is that we will take on here, what it is that is safe for us to do. As a small country, like other countries, we sometimes observe what other larger areas are doing and take our guidance from that. So at this present time, we have not taken on any new treatment, but we continue to observe what is happening in the global space.
All right, thank you very much, CMO, and thank you to our media partners for those questions. We're going to move on to our other segments.
All right, thank you very much, Stephen. Thank you, CMO, and the questions that were asked. We're going to move quickly into a very brief discussion around the numbers, and our epidemiologist, Dr. Webster Carr, is going to briefly just give an overview. The issue here, listeners, is really looking beyond the positives and the negatives and the testing and dissecting the numbers to see what exactly they mean, particularly in the context of a virus that is likely to be with us for some time. We're not going to eliminate totally, or the possibility of that happening is unlikely or remote. So it really is about how do we exist as a society, how do we get back to normality with the threat or the risks surrounding COVID. And we are going to have to manage that process in a way that protects the public's public health interests, while at the same time restoring some level of normality to everyday life, everyday living, and to economic activity. So, there's, for example, a tendency to focus just on the positive tests, but very little conversation takes place around the percentage of those who are positive who are asymptomatic, as opposed to those whose severity of illness requires ICU care or high dependency care. The CMO indicated earlier that we have no one now in ICU as a result of COVID, even though unfortunately we have had a number of deaths since the first positive case. It therefore means, and we did predict this in terms of the modeling, that the vast majority of Jamaicans who get COVID are going to recover and recover within reasonable time and be reintegrated into society. So I'm going to ask Dr. Webster Carr to just do a little bit around the numbers and what they mean, so that the public can be better informed. Dr. Webster Carr.
Thank you, Minister. Good evening. So I'm going to take you on a little bit of a journey with the numbers. Jamaica, just to indicate, WHO has some transmission patterns. When we had no cases, sporadic cases, when we moved on the 10th of March to that, and then clusters of cases. The other phase, it's the community transmission, which may be imminent. So I must say, now, these are the numbers from this morning at 8 a.m. The numbers has changed by 4, but I think we can get the picture from what I have to say. 35 were imported, and 11 are local transmission. These are cases which we cannot link otherwise. And we have 171, which are contacts to confirm cases. 306 persons out of the 474 are related to that workplace cluster. We have tested 6,095, of which we have the positives. So how does this rank with other Caribbean countries? When we looked at 14 other Caribbean countries, as of yesterday's date, Jamaica ranked first with the total number of tests done. Yesterday was at 5,993. This was followed by the Cayman Islands at 3,050. But when we compare number of tests per population, Jamaica ranked 8, and first was Cayman Island at 46,000 per million. We came 8 out of 14. With respect to the persons, their health, as CMO said early on, we have no critically ill person right now from COVID.
2 are moderately ill, and we have more and more recovering each day. Most of the persons don't require hospitalization and are not necessarily isolated in hospital. So over time, we have seen the increase in cases, and if we take out the workplace cluster, we are on a straight line. When we have in that cluster, we are on exponential. So that was a surge, but that is not necessarily the true surge that we were thinking about. So when that surge occurred, we went to doubling every 5 days. Currently, we are moving towards 10-day doubling, or just about a 10-day doubling. So there's some flattening that is occurring. So we look at the number of cases by their date of onset. Some persons would not have had symptoms, so we use the date of the test. And what we're seeing, it peaked around the 13th to 15th of April, and the numbers are decreasing currently. So we looked at how did we find all these cases. The health department investigated all confirmed cases. They went and found 3,385 persons that were named. This is not including communities that have been surveyed. This method has been the most effective method, and we gained 390 cases from this method, many of which are asymptomatic, so we would not necessarily have found them. So we have been, that method is the method to pull out persons who may be infectious from the general population. So when we look at those cases that were contacts, the colors that are similar are the clusters of cases. So that orange would be those persons related to the workplace cluster. Looking at the age, for the most part, it's mostly the younger persons are involved. But when we take out the workplace cluster, then it's middle and older persons who are involved, because the other group is younger. The workplace cluster is very young. When we look at the sex distribution, mostly females, but when we take out the workplace cluster, it's mostly males, 56% males compared to 44% females. When we look at parishes, St. Catherine leads, followed by KSA. When we take out the cluster, KSA leads, followed by St. Catherine. So looking at the workplace cluster, this map gives you the workplace cluster and where these workers are found. So symptoms, what did persons have? Most persons had cough and fever. But something that we have seen, the loss of smell and the loss of taste have been seen. When we look at combinations, persons tend to have only a cough followed by cough and fever together. We have had 473 of the confirmed cases, about 42 had at least one of the top 6 comorbidities, and some had many. And the picture gives you the combinations that are there. So persons with asthma are coming out highly. So assessing community transmission may be silent. And what we want to do is find out what's happening in the community, because we don't want the COVID-19 to start screaming at us. So the method that we use to find these is respiratory infection surveillance. So those persons who may have a fever and a cough or a sore throat, we are testing those. And this particular surveillance system found 36 cases. So since week 11, we have been seeing cases from this method. So what it's saying to us is that there is some local transmission going on, even though it may not be large numbers yet, but something is happening. This means that we all have to be careful how we operate or how we act, because we don't know who may be having COVID positive. When we look at where we found these cases, the majority were in Kingston and St. Andrew, followed by St. Catherine, and also Portland, St. Mary, Clarendon, and the border of Manchester to Trelawney. Those are the areas of concern. So what are these numbers showing? That we are increasing the number of cases, clusters that are not related. We have COVID cases in all parishes except for Hanover. The number of cases identified through our respiratory surveillance, that is trying to find the community transmission, has been generally increasing since week 11. So the message to everybody, stay home unless you need to go out, essentials of life. And when you go out, stay at least 6 feet from others, wear a mask, remember to wash hands with soap and water frequently, and stay home if sick. Work from home where possible, and we all need to protect the vulnerable.
Thank you very much, epidemiologist, for this brief presentation on the numbers. I think we will pull some of the numbers and post so that persons can have an idea as to what is happening, because we want to be as open as possible to the population in terms of the numbers, what is happening behind the numbers. Some of the things that jump out very quickly is the sheer extent of the work on the ground to collect the information. Over 3,000 persons contacted outside of those communities that have been quarantined, which would mean a lot more. Of that 3,000 plus, over 300 positives were extracted. The reality is, ladies and gentlemen, if one of those individuals was not identified, it could mean multiple cases. And so the efforts of our contact tracers on the ground, absolutely critical. Putting the numbers together just to assess and to move forward, very, very important. The other is that comes out behind the numbers is the extent to which persons are asymptomatic as opposed to being symptomatic, and the impact of comorbidity or underlying conditions on the extent or impact of the illness. And that slide was quite interesting. So for persons who have diabetes, hypertension, asthma, you have to be particularly careful. Recovering from cancer or being treated for cancer, you have to be careful because it means that you are particularly vulnerable to the virus. The same would apply for persons over a certain age, which is why the rules say stay home if you don't have to go out. The other very important element of the numbers, to my mind anyway, is the extent to which persons need hospitalization, again on the asymptomatic versus symptomatic. It's important for the country to realize that while the virus is highly contagious, and so we need to know who are positive, and so that they can be appropriately positioned to avoid spreading the virus. For the most part anyway, persons who have been positive to date have not been in a position where they feel, where their their life is under threat. What it means is that they need to be treated, but they are asymptomatic, which is likely to be the pattern of the virus over time. And as a consequence, we would now have to find where those vulnerabilities are, the underlying conditions, and give added protection and support to those persons, recognizing that the healthier population within the country are likely not to have severe symptoms. This raises a question of home isolation versus institutional isolation, which I think is going to have to be a discussion point in the near future, and we will comment on that as we move the process forward. So there is a lot to be said around the numbers. I think it's important on testing, which I know has come up a lot, to indicate that Jamaica is not the worst in the Caribbean as it relates to the numbers of tests, not just the absolute numbers, which puts us out ahead, but certainly tests as a percentage of our population. And we are somewhere in the middle, and we have made significant progress over time. And I think the big story coming out of this press briefing is that we're now moving to further expand testing because we have the capacity, which includes persons who have an interest in being tested, going online, filling out that form on jamcovid.com and stating their case, and then we will follow up with them, and that should start in due course, plus the antibody testing, which the Chief Medical Officer spoke about. I've closed on this section to say we think that we need to do more from the Ministry of Health and Wellness to highlight other elements of the state of COVID outside of just the positives, outside of just giving the sort of absolute or numbers around positive versus negative. We think that we need to highlight some of the other features of COVID, like the recovery, like asymptomatic versus symptomatic, so that the population can have a better understanding while still observing the advisories that we send out to provide support. The Chief Medical Officer wants to say a few words, and then our final segment will be a brief interview with a recovered COVID patient. CMO.
Yes, it's just a clarification, Minister. Someone asked to differentiate between mobile testing and mobile sampling. So the tests are not being done in the field. We collect the samples. So the mobile units collect the samples and they are taken to the laboratory where they are tested.
Okay, thank you very much. So the final segment is discussing with patient patient M. It doesn't matter, right? RM. But a patient who is no longer a patient, has gone through treatment, tested negative on two tests, and is now at home. And we thought it was important to just hear from her. Patient M, good evening to you.
Good evening, Mr. Tufton, and how are you?
I am fine. Did I lose her, or is she still on? Hello? Good evening. Okay, something is wrong with the mic. All right, so while she comes on, is she on? Okay, good evening.
Good evening, I'm hearing you clearly now.
Excellent. So listen, tell us on Jamaica. First of all, thanks a lot for coming on. Really appreciate it. I think it's important to share the stories of persons who have been through the experience. Tell us a little about your experience, how you found out you were positive, and what transpired right through to the point when you were released, and just briefly.
Okay. Well, I was at home, and then they tested me and said I'm positive, and then I went to the hospital, and then you have to do some tests there to get negative, and when you get the two negative, they send you home.
Right.
But I have one concern for the hospital.
Before you get to the concern, and I'm very anxious to hear that, how did you how did you, do you know how you became positive? Is it that you got it from someone, or you brought it in, you were traveling, what?
No, I was just in a vehicle with someone, you know.
Okay.
I didn't know that the person was sick or anything.
Right. That's important to know, which means, you could pretty much pick it up anywhere, right? You were just a citizen going about your own business.
Yes, sir.
And then, how long did you spend in the hospital?
I spent 1 week in the hospital.
Okay.
But I was quarantined for 3 weeks at home before I was tested. That's our next concern. A concern is that if you put somebody 2 weeks for quarantine or isolate at home, I would like them to be tested the same instead of staying there, and then after you think you will come out after the 2 weeks, then you have to get tested that time.
Mm-hmm.
I would like the test to be done in between the 2 weeks, so you know exactly where you stand.
Right. Well,
That could be done.
Right. Okay. But you do understand why the home quarantining was important, given
Yes,
the
sir.
contact and the possibility that the virus would need some time to develop. I suspect that's the explanation, or certainly that's
Yes,
my
sir.
understanding of
Yes.
it. But you
Yes,
were when you were at home, you developed symptoms then, or based on the tests you found out you were positive?
It's based on the test I was found out that I'm positive.
Okay. And then you went to the hospital and you spent a week there.
Yes,
And
sir.
how was that experience? I won't ask you which hospital. You don't have to say.
Well, the experience wasn't so bad, but I can't say for everybody. But for me, my experience wasn't so bad. And the only thing I have a concern with is like you need a little buzzer on the bedside or something, because where the doctors are and the nurse are, they can't see everyone.
Right.
So maybe somebody in the wee hours of the night maybe get ill. That person can't move to go to that location. Then you can put a buzzer there to say, well, that person can alert the nurse or the doctor that something is going on.
And that's a very valid observation. So you and I spoke off here and you raised that, and I'll certainly follow up with that particular institution. I know in some hospitals they have cameras that actually monitor patients, and it seems that may not be the case, or may not have been the case in your case. So we'll follow up on that. But otherwise, though, how was the experience in terms of your doctors, your nurses, and that sort of thing?
Well, the doctors and nurses are very good, and there's a particular doctor that will come on and talk to us. I wish not to disclose his name on the here. And the patients, some of the patients, they will get frustrated because if you're in there and you're not getting your test result and it's taking a little longer time, or you're feeling, people will feel depressed at times. Really depressed because you're not going out, you have your business to go and do, bills to pay, and you understand nobody can see you, you're isolated, so it takes a little while.
It is a challenge, and when you're not used to that and you're a hardworking individual and you have children to take care of and home and so on, then you can fully appreciate. I think every Jamaican can relate to an experience where you are now required to stay in an isolation setting, especially if you don't feel that sick, right? And you were asymptomatic for most of the period. You didn't have symptoms.
Yes, sir. I was asymptomatic.
All right. Well, I hope you understand.
The next concern before you go.
Yes.
I would like you to raise an aware campaign for this stigma, because it's another thing, just like how you have the dengue virus and all of those, so that people can be aware that it is not a death threat. Because some people will get sick more than some because of the underlying problem that they have, and some immune system are stronger than some.
That's exactly where I was about to go. How do you feel since you have gone home, gotten release, both personally in terms of your state of health and state of mind, but also your neighbors, your friends? What is their reaction towards you?
Well, the stigma is that I still have COVID and they don't want me near them. They don't want me near their children. You can't go on the road. Everybody telling that person have the COVID, even though you come out the hospital.
So you're branded basically.
Exactly so, sir. And if they know that somebody is related to you, they say that person have it, they don't want them around them. Which in case they don't have it.
Mm-hmm. Mm-hmm. So what do you have to say to those people who are treating you in that way? Any advice?
Well, the only advice I'm saying is that people are scared and they need to know the facts. Like a campaign as an awareness campaign to let them know that this thing is not going to kill them. Mm-hmm. It's just another phase.
Right. All right.
Right.
Well, and you have any final thing you want to say? Any final concern that you have? Because we like to hear the concerns too.
Yes, the final concern is that, not with me, but you have other people that was in there. I would like to get them tests done quick. Right. I mean, get back the result quick. And those who is at quarantine at home, some people quarantine at home can get, but because of the backlog that was in Kingston, for see if we could speed up that process. That's all I could say, because the stressing is not nice.
I fully understand and I appreciate, and the backlog has now been cleared up, so we're hoping that we won't have that issue again. But I want to thank you for coming on and for expressing yourself. We're happy you're feeling better now, but still very concerned about the stigma and the discrimination, and you have articulated it again. Others have too. And from our perspective, we would like our listening public, the journalists, others, to help us to overcome this stigma. The truth is, COVID is not a death sentence. When you would have recovered, you should go about your business without anybody branding you or tagging you in a negative way. And indeed, the community should help you because, frankly speaking, everybody is at risk. As I said over and over, today for me, tomorrow for you, or vice versa. And so everybody counts in terms of the rescue plan. So I agree with you. We are doing some public education programs, but we're going to have to step that up to try and overcome the discrimination that clearly is a big feature of the COVID response experience. So thank you very much, and all the best to you and your family. You have children?
Yes, I have 2 children, yes.
All right. Well, I know they're happy to see you back home, right?
They are not home with me at the present.
Okay.
But they will.
All right. Thank you.
And you must big up the nurse and the doctors that are in this field because they're taking a risk too.
Big them up for me now, please. I big them up every day. They probably want to hear from you.
Well, big up all the doctors and nurses and all who is out in the field and in the hospital, because they are the ones that are keeping us alive, and they are at risk too. And good health to them, and God bless them.
That's so sweet. I mean, very, 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 very appropriately said. And they are, in fact, our heroes, and that's why we have to celebrate them at this time of a public health crisis. Thank you very much. Enjoy the rest of your evening.
Same to you, Mr. Tufton.
Okay, bye-bye.
Bye-bye.
All right, so there you have it. And in closing, I think we're on to our hour and a half, so we're still a little under an hour, right? Little over an hour, so we still haven't gone on too long. I want to just thank all who have made it possible this evening. Sorry again for the 20-minute late start. Thanks to the CMO, the permanent secretary who is here, Dr. Webster Carr, epidemiologist, and the team from Phase 3, and all the others, the PR department and others. We have a little treat for you. This is a friend of Jamaica, Steve Harvey, who sent a little note for Jamaica around COVID, which we asked him for, and we're going to use this medium to just signal it to Jamaica. Thank you very much. God bless and keep safe.
Hey Jamaica, listen, this is your man Steve Harvey. This COVID-19 has gotten out of hand, it's very bad, and it could do the same thing to my beloved Jamaica. You have a chance to get ahead of this thing. But you've got to do it by practicing social distancing. You've got to do it by quarantining, stay at home, stay away from large gatherings, stay away from people. Don't let people in your house. Stop shaking hands, man. And you have got to wash your hands. If you leave the house, wash your hands. If you've been sitting around, wash your hands. Keep your hands out your face and your eyes. You've got to do your best. Come on, Jamaica. We can't afford to let nothing happen to you. It's too beautiful over there, man. I want to come back and see you soon, but I want you all to be there. Protect yourself. Wash your hands. Practice social distancing and stay in the house. It's okay. It's okay. This too shall pass. Take care of yourself. This is your man, Steve Harvey, because I care about you, Jamaica. Yeah.